Hi, I'm Meris, and in this video, I'm going to be talking to you about the lab value lithium. I'm going to be following along using our lab values flashcards. These are available on our website, leveluprn.com, if you want to grab a set for yourself. Or if you are more of a fan of digital products, I would invite you to check out Flashables, the digital version of all of our flashcards available on demand and at your fingertips wherever you are. All right, let's go ahead and get started. All right, so what is lithium and why do we care about it? So this is a lab value that we're going to be monitoring in somebody who is taking lithium as a pharmaceutical intervention, most likely for bipolar disorder, although there are other possible reasons that this might be prescribed. Lithium is one of these medications that again has a very narrow therapeutic window, meaning that we need to keep our eye on people who are taking it to make sure that they are not subtherapeutic, meaning below the therapeutic threshold, and that they have not become toxic to it, where their level has risen above that therapeutic threshold, and now it's not doing good stuff for them, it's actually making them sick. So this is why we need to monitor this value in somebody who is taking lithium, is to make sure that it's doing its job, but it's not making them ill. Now, the therapeutic range for lithium is going to be 0.6 to 1.2 MEQs per liter, or milliequivalents per liter. So again, very, very small range. I love this range though, because it's very helpful. 0.6, 1.2, that's just double, right? So if you can remember one of them, hopefully you can remember the other. But there's an important thing that I want to call your attention to, which is that when we talk about lithium toxicity, we're not talking about it until we get above 1.5 MEQs per liter. So just keep that in your mind, that that's really the point in time at which we are going to be, this patient is experiencing lithium toxicity. And now I want to talk to you about what some of those findings are going to be when associated with lithium toxicity. When I think of lithium toxicity, I think of tremors. It starts off fine, so just this fine little tremor that's going on, and it becomes more coarse. So as that level rises, the tremors will become more coarse, more large versus these fine, small movements. So coarse tremors are definitely on your list. Confusion, hypotension, seizures, tinnitus, coma, death, right? Anything like that. It's very possible for lithium toxicity. Hopefully we catch this well before they end up in the seizures, coma, and death part of things, right? So that's again why we need to educate our patients. Hey, this is why you're coming in for this level. This is why it's important to keep these appointments. If you become toxic to it and we're not aware, you will become more and more toxic to it until really bad things can happen. Now, there's another thing that I want to talk to you about, which is that lithium and sodium, when they interact in our body, they have this inverse relationship, meaning that as your sodium levels drop, your lithium levels will increase. So hyponatremia is an electrolyte balance that really puts our patient at risk for lithium toxicity. Even if they've been taking their lithium exactly as prescribed and they've never had issues before with toxicity, if their sodium level falls, they are now at risk. Why is this important? Really, really critical thinking here is this electrolyte is very, very affected by my fluid balance, right? It's also very affected by things such as heat. If I start sweating a whole bunch, I can lose my sodium. Or if I'm out running a marathon, doing something like that, and I'm drinking a bunch of water, I can end up diluting down my sodium. So very important to educate patients who are taking lithium about this relationship between lithium and sodium and the need to maintain a consistent fluid intake and to do things such as avoid really hot environments or avoid things that can make you excessively sweating. This would be something that would put our patient at risk for lithium toxicity, and this would be really important patient teaching for them. All right, I'm so glad you stayed until the end because I'm going to test your knowledge of some key facts I provided in this video with some quiz questions. Why is it important for a patient on lithium to maintain consistent fluid intake? Dehydration can increase lithium levels, leading to toxicity. Which electrolyte imbalance increases a patient's risk for lithium toxicity? Hyponatremia. All right, that is it for this video. I do hope you learned something. If you did, would you leave us a comment and let us know what you learned? We really like seeing that. And hey, if you have a great way of remembering something that I didn't mention, leave us a comment with that too. We like seeing it, but I know it's beneficial to other learners as well. All right, I'll see you in the next one. Thanks so much and happy studying.
We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.